Patients are often referred to our office for an assessment of implants, maybe multiple implants, and oftentimes these candidates are struggling with multiple teeth, decay, and multiple issues in their mouth. And at a certain point, we have to weigh the pros and the cons. And I want the patients to have a stable, secure smile. And we can achieve that by removing all of the teeth and placing 4 to 6 implants, and teeth go on top of those implants. And we can do that while patients are asleep. And it's a truly transformative procedure. Surprisingly, their post-operative pain is remarkably less than what they imagine. And that's due to, I think, a combination of appropriate surgical technique and use of the right medicines in the post-op period, truly optimizing the non-steroidal anti-inflammatories and the Tylenol in the post-op period. It's quite surprising. Brush your teeth as normal. Use a water pick, just as you perhaps have done in the past and what people do every day. Your teeth will match, and here's the beautiful thing too. When you talk with your restoring doc and talk with your oral maxillofacial surgeon, you can tell them and indicate what you'd like to have for teeth. Maybe you never liked the shape of your teeth. Now you have the opportunity to craft the beautiful smile that you want.